Why is a plant-based diet so great for vascular health? You have a lot of experience working in vascular surgery. Can you give us a little more insight into that?
Sure. Yeah, I was in vascular surgery unit, and it was tragic, to be honest. I saw a lot of people living with diabetes and heart disease and peripheral vascular disease. They were having toes, mainly lower legs, sometimes upper legs amputated, and quite often they'd start with one amputation and the gangrene would keep spreading, and they'd have to have another procedure and another. And it was a very depressing specialty because people never got better. And also, we never discussed diet. We never discussed diet during that block. So when I was on that job, it was just never even conceived of. But it's so important because we know that underlying inflammation is key to heart disease and peripheral vascular disease, because it's all caused by underlying atherosclerosis, the hardening of the arteries and the inflammation that occurs in the arteries. So you've got this arterial wall, you've got the endothelial lining. It's a very thin layer, and it's really helpful for us. It produces nitric oxide. It can be very responsive to stimuli. It opens, it sort of swells and constricts. But when you have heart disease, it gets very stiff. It fills up with plaque, and there are a number of reasons for that. And you have cholesterol going through the bloodstream, and those small dense LDL particles can stick to the side of the arterial wall. And they do that with the help of other toxins and other precursors of inflammation. One in particular that I was going to discuss is TMAO. Should I discuss what TMAO is, or do you think?
Yeah. Let's go into it actually, because TMAO is something that a lot of plant-based physicians are talking about. Dr. Greger's talking about it, Dr. Osfeld's talking about it. So why don't you give our listeners a little bit of an introduction into what TMAO is, what foods promote TMAO production, and what results happen when there's an elevated TMAO level in your blood?
Sure. So when you eat meat, when you eat eggs, when you eat dairy products, basically any kind of animal product, they will contain carnitine and choline. Eggs especially have a high choline content, and other animal products have high carnitine. And these are macronutrients, but in excess, and certainly when you take them through your diet in the form of animal products, what happens? Well, they get digested, they get fermented, they go down to your gut, and your gut bacteria do a grand job of fermenting the food. And what they do when they're fermenting it is they cause the release of something called TMA, trimethylamine. And that in itself isn't particularly harmful, but your body has to process it. So it goes to the liver. And then what does the liver do? The liver turns it into TMAO, trimethylamine oxide, and that is toxic, unfortunately. I think it's, especially with heart disease, but also with kidney disease, it's a toxic combination of having these high levels of circulating cholesterol, LDL cholesterol, combined with the TMAO, which causes this extra plaque formation, inflammation. It can worsen heart disease, it can worsen kidney disease, it can worsen heart failure. And if you remove that from your diet, then you're basically allowing the space for your arteries to respond again. You're allowing space for your arteries to breathe, as it were. So TMAO is particularly toxic. And I think Dr. Greger, actually, who mentioned him, I think he talked about a study where they were getting people who don't eat any animal products, and they were trying to find out, do they produce the same TMAO concentrations as those that do eat animal products? And they found that, you'd feed a vegan a steak and no TMAO is produced. So a lot of it is mediated by the gut microbiome, and that's really crucial for this particular toxin.
Right. So effectively what you're saying is that when you eat a diet that's high in animal-based products, then your gut microbiome, effectively the population of bacteria inside of your gut, is perfectly, what's the word I'm looking for? It's like it
harvested.
What's that?
Yeah. It's perfectly harvested to create the toxins. So exactly. If you don't eat those things, then you have a very different bacterial colonization. And fortunately, if you're having a predominantly whole food plant-based diet, you're going to be having loads of fiber. And fiber is fantastic for your microbiome. It's the main fuel source for your beneficial microbiome. What happens when you break down, I mentioned about when you're breaking down these animal products, when you're breaking down fiber in the gut, you produce short-chain fatty acids, and butyrate's one that most people are perhaps more familiar with, but they are absolutely crucial for good microbiome health. They feed them, they nourish them, they reduce your cholesterol that's circulating in your bloodstream. They reduce inflammation, they reduce cancer risk, and that's what feeds you good gut bugs. It's the dietary fiber. And even if you have beneficial gut bugs and you're not having enough fiber, they can actually become harmful in a way, because they start to eat something. They've got to eat something to survive, so they start to digest some of the mucin lining of your gut, and then that can lead to other issues with inflammation within the gut. So you've got to keep that fiber coming.
I love this. I love this. So you mentioned that kidney health is something that is influenced by TMAO production. So I would say in general,
definitely
confusion about kidney health. What foods are good for kidney health? What foods are not good for kidney health? And then especially people who are living with impaired kidney function, they're told to eat diets that are low in potassium and low in magnesium. So can you shed some light here on what a patient who is living with either end-stage renal disease or some form of kidney disease, what can they do? And how does eating a plant-based diet actually improve their overall health?
I think I'm glad you brought this up, because it causes so much confusion. I saw a gentleman recently with end-stage renal failure, and he and his wife were in an absolute state, because they were saying, we've got to cut our potassium. We can't eat anything with potassium in it. And these foods that contain potassium, they're healthy foods. You don't want to have to cut out melons and oranges and bananas and avocados. These are really healthy food groups. So basically the bottom line with that is I would always aim to, first of all, if you've got end-stage kidney disease, and a lot of people with diabetes may well end up with advanced kidney disease, you must get your labs checked. You must just double check what your bicarb is, what your kidney function is, what your electrolytes are, and then you can begin to make some sensible decisions. Because the good news is you can do something with your diet to improve your outcomes and potentially improve your kidney function as well. So we'll park potassium on the back shelf for now, because the main thing that people need to know to avoid is the so-called meat sweet diet, actually. So the reason that the animal products can be a big problem for people with kidney disease is because of the animal proteins. The animal proteins cause something called hyperfiltration, and hyperfiltration is it's a necessary thing. Sometimes your body is made to do it. So when you give yourself an occasional excess animal protein load, then your kidneys can usually deal with it. But when you're eating animal products for every meal, so when you're having meat and eggs and things like that, every time you have a meal, and many of us do, many people decide that a meal is not a meal without a piece of fish or a piece of steak or some egg or some cheese or something, you're putting real pressure on your kidneys. There was a study that researchers did where they gave people some tinned tuna, and they were trying to watch for hyperfiltration of the kidneys, and the kidneys increase their filtration rate by around 36% within 3 hours of that one meal. So if you can imagine doing that day after day, meal after meal, it puts an awful lot of pressure on your kidneys. What do the kidneys try and do? Well, they produce a little bit of ammonia to try and rebalance the acid base. And other researchers have said that maybe one of the reasons why kidney function does tend to reduce over time is because of chronic overproduction of ammonia, just to try and counteract those acidic foods. Because meats also contain sort of sulfur-forming amino acids such as methionine. And again, if you're having to always process these things, because the kidneys do a grand job, they process everything, all the toxins and all of the amino acids, all of the different nutrients. So they've got to keep everything in balance. And when they're constantly having to fight these sort of acid-forming foods, then it does affect function over time. I think animal proteins are a big no-no. And I say meat sweet because the refined sugar and the refined flour also compound the problem. They are acid-forming foods, and they just put more pressure on the kidney. So it's that toxic combination which is really key to avoid for people with kidney disease. So getting back to potassium, I would advise anyone living with kidney disease that even if they have end-stage kidney disease, as long as they have a normal potassium level, they can eat as many healthy whole plant foods as possible. It's not going to be detrimental to their health. There's no real-world evidence to say that reducing the potassium from healthy foods is going to make any impact on your kidney health. So as long as your potassium levels are normal, crack on and have as many healthy foods as you can. Also, it's worth talking to your doctor, because if you're living with kidney disease and you have a raised potassium, it might actually be better to do a medication review before you start cutting back on your potassium containing foods, because there are certain medications that can increase your potassium, and you may find that they're more harmful for you if you're in a situation of hyperkalemia, high potassium levels. So for example, beta blockers, ACE inhibitors, they both can increase your potassium, and there are certain kinds of diuretics, which are medications to help improve kidney function and get rid of water retention and improve blood pressure, which may actually improve things. So it's really worth getting a medication review if you are living with kidney disease and you do have a high potassium, and it's not a good idea to just cut out the healthy foods. And phosphorus, that's another big thing that people don't talk about enough. Phosphorus is a mineral like potassium, but in excess it can cause worsening of kidney function, and also liver disease. Phosphorus can come in many forms, but if you're having a whole food plant-based diet, interestingly, your body doesn't absorb quite as much of the phosphorus from your whole food plant-based foods as it does from animal products. So again, you're onto a winner there. But if you're having a whole food plant-based approach, I would still advise you to avoid things like juices and pre-packaged sauces that have preservatives in, because they will contain phosphorus containing preservatives, and that's really important for people living with kidney disease. Read the packets, make sure that you're not eating anything containing things like sodium triphosphate or anything with phosphate in the title. Basically, it's not going to be good for your kidney function, and that can be things like canned meats, certain baked goods, processed meats, cola drinks, other soft drinks. So there's an emulsifier as well in chocolate. I don't know if you have E numbers over there, but there's an E number, E442, which is an emulsifier, which again contains phosphorus containing preservatives and is really bad for kidney function.
Okay, this is great information here. I want to switch gears real quick here. What is the cause of diabetic nerve pain, and can it be reversed?
Nerve pain is horrific. It's really hard to deal with in medicine as well. Diabetic neuropathy we think it's caused by excess glucose levels in the bloodstream for a long time. It can be toxic to the nerve endings, but it's not just diabetes that can cause it. You can get it from having had shingles or certain nerve injuries, and even chronic kidney disease and things like that can contribute to sort of neuropathy. And it's awful. People are in so much pain with it. It can sometimes be sort of just things like tingling and numbness, but for people who suffer from pain, it's horrific. And there aren't very many easy treatment options. This is the problem that we face. We try different medications, but they don't really work very well, and people are still struggling with it. So I advise people to go on a predominantly whole food plant-based diet, because I've read studies, and I have a couple of patients that have said that they themselves have noticed a huge improvement in their neuropathy pain from adopting a whole food plant-based diet. And there's a study about 20 years ago which showed this to be true. They took 21 people who had severe painful neuropathy. Some of them have had it for over 10 years. And they actually had them in an inpatient setting, and they said, right, we're going to control what you eat. You're only going to have whole food plant-based options. You're going to exercise for half an hour a day and see what happens. And what they noticed was just absolutely incredible. Of the 21 people, 17 people noticed significant reduction or absence of their neuropathy pain. It's unbelievable. These results were super fast as well. I think the average response time was around 9 days, which is far quicker than you'd expect for any kind of reversal of the damage. So I'm not really sure why it was so quick, but it may be something to do with extra oxygen flow, basically sort of to the blood. But yeah, it was absolutely amazing. And these people, they followed them up, and those that had benefit, they continued on this diet, and they lost weight, they improved their insulin usage. I think some of them reversed their diabetes. They reduced their blood pressure meds by about 80%. So what's fantastic about this is that there's no side effects, like many of the medications that we actually try to prescribe, and there's just benefits. So I'd say if anyone's suffering from severe neuropathy, please go for whole food plant-based diet. You can only benefit. Let's see what happens.
That's exactly right. That's what we always say. In a lot of these cases, you have nothing to lose. Only
nothing to lose.
Nothing to lose.